In this film, Mrs. Goldie is attending the nurse consultant. The day before, she has seen a consultant doctor who has broken the devastating news that she has breast cancer. So this is a difficult and emotional conversation. You will see the nurse providing support and discussing treatments such as surgery and chemotherapy. The nurse concludes the consultation by using Teach Back to check Mrs. Goldie's understanding.
Good morning, Mrs. Goldie.
Hello.
Hello. In you come. Have a seat, please. Are you okay there?
Yes.
Okay.
Thanks.
Okay. My name's Sandra White and I'm the nurse consultant for cancer.
Sandra.
Hi. We're here today to discuss your meeting yesterday and your treatment, your tests, everything that you had yesterday. Is that okay? You okay to do that?
Yes, of course.
Okay.
Yes, of course.
Good. Can you tell me what you remember about yesterday?
To be honest, it's quite a blur.
Yeah.
There seemed to be so much going on, so much to take in, and it came as quite a surprise to me what the consultant actually said the results had shown. He was talking about an operation. He was talking about chemotherapy and something else.
Okay, it's okay.
And I just found it really difficult, and I found it quite difficult to kind of ask questions, really.
Well, it's a lot to take in a short space of time, isn't it? So perhaps today, if it's okay with you, we'll just take a bit at a time so that we can work our way through it.
Right.
Okay.
Right.
Do you know what your results showed and why you need to have surgery and treatment?
Yes, it showed that there is cancer in my breast, sort of around here, and he was concerned that it was not something that could just be removed. He was talking about having to have the breast removed, and not just the breast. I don't know. He was saying sort of a bigger area.
Right. Okay.
I don't understand that.
Maybe if we start from the beginning and, as I said, just go through it. When you had your mammogram and they would have taken a bit of fluid from your breast with a needle,
yes, they did.
and the consultant would have examined you, what they found was an area in your breast, and your test showed that it was malignant. And that's what you mean with your cancer, with it being a cancer. Okay? And sometimes the cancer, they have to find out if there's any evidence of the cancer within your lymph nodes. And your lymph nodes, we've got lymph nodes. Am I going too fast?
No,
Are you okay? You okay?
That's fine now.
You have lymph nodes throughout your whole body, and they work a bit like sieves. They collect any cells or any cancer cells that are there that shouldn't be there, and they do their job by trying to get rid of them. So it's good that we've picked that up, and what they're offering you now is to have, as you said, surgery, a mastectomy, the removal of your breast, because what they feel is that would be the best way to remove all the area that's involved.
Yes.
And to make sure that they find out exactly what's going on in your lymph nodes under your arm, they'll remove some of your lymph nodes as well.
And can I manage all right without the lymph nodes? Is that?
Yes, there are systems in place that will compensate for that. You will have to be a bit more careful about the care of your arm. But you can still do lots of things that shouldn't hold you back with a lot of activities that you might normally do. Just have to be careful around, infection and not getting too many injections and things like that in that arm.
All right, because it's my right arm, and you know that's where normally things get done.
Yeah, but there's, as I say, there's, as long as you take the precautions, it shouldn't hold you back too much.
Okay.
Okay. Can you tell me what you understand about that now in terms of your surgery?
That they're going to take away my breast, and it'll go also into the nodes.
Yeah, that's right. Now that will take away, we hope, the problem within the breast, and because of your lymph system, it's got the capacity for the potential for cells to have gone in other areas. So the reason that they would have talked you about chemotherapy is to mop up any areas that might be out with the breast and under the arm. Okay, so they use it
to stop it spreading, is that what you mean?
to hopefully stop it spreading. Yes. Now the treatment for breast cancer is improved greatly over the last few years. The treatments are very, very good. You know, women who have been diagnosed with a breast cancer, you know, a lot of women do extremely well and get back on with their own life. It's a lot to take in at the very beginning, and sometimes all the treatments and everything that you've got to think about is immense. So it's probably best if we focus just on your surgery at the moment, get you through that, give you all the support that you need.
A big question in my mind is to,
Of course.
am I going through all this, and will I come through it, or will I not? And if it's there, you talk about it possibly spreading.
It's a lot to take in, but what they're doing is giving you the best possible treatment that they can give you to prevent it from returning. I suppose it's important that you know that they're giving you lots of different treatment: the surgery to remove the cancer, the chemotherapy to help prevent, to remove anything that may be there, help prevent it come back, and also they may offer you some radiotherapy where they've removed the breast at the end. Now that's an awful lot to take in.
So I'm going to be in and out of hospital for months, is that what you're saying?
You won't be in and out of you'll be in and out as a day case for quite a long time, yes.
So it won't just be the operation and that's me?
Possibly not, no. The treatment that they're going to give you is quite intense. It will take over your life for quite a number of months. And the reason that they give you it is to help reduce the risk of the cancer returning. So what we want to do is provide the best possible support that we can for you and make you as independent as we possibly can. A lot of women, when they're going through their treatment, continue working.
Am I going to be able to work at all during all this?
You may well be, We have to assess you as you go along, but we don't want to stop everything in your life. But as long as you're well enough and there's, as you say, you've looked after yourself, there's no reason why you shouldn't manage to do some of your work.
Right.
What the consultant's written in your notes is that they hope to get you in probably in about a week's time for your...
A week?
Yeah, a week or two's time for your surgery. Yep.
Oh, okay. And how long would I be in?
Sometimes you're only in for a couple of days. Sometimes it's a bit longer.
Really?
Yeah, you're not in terribly long. And you'll be out your bed the next day.
Goodness.
Yeah, so I think if we focus on getting you through that bit first, and just little chunks, you know yourself that it's easier to manage if you deal with things in little chunks.
Yeah.
So the plan would be, if it's okay with you, is that we've got a couple of things that we would like to maybe conclude with today. You can contact me anytime. I'll give you my card before you leave.
Good.
And you know, we'll have regular appointments to make sure that you're doing okay, because attached to what you have to have as a person, and we want to make sure that I provide as much support, and all the team will do that.
So I'll see you again.
Yeah,
Sandra.
oh yeah.
Okay.
Okay.
Yeah.
So tell me, can you, just so that I know that I've explained everything in the best way for you, can you just tell me what your understanding is of our meeting today? What the next steps are?
I'm going to have an operation in probably about a week or two's time.
Mm-hmm.
And then after that, there may be some more treatment. Yeah. And that I'll hear in the next day or two.
About your surgery?
Yeah.
Okay. No, you've got a good team looking after you. Your consultant surgeon and your oncologists are the best. You know, and they'll really be there to help you through all of this. Would it help you to speak to somebody that's been through this?
Not at the moment, no.
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 Okay, maybe
Thank you.
later.
Maybe.
Okay.
Thanks very much
Nice to
indeed.
meet you.
It's very nice to meet you.
Speak to you tomorrow.
Thank you.